Hello, my name is Congressman Tom Price, and I represent Georgia's 6th Congressional District. Before coming to Congress, I was a physician. I spent more than 20 years caring for patients as an orthopedic surgeon. My goal was to provide the highest quality health care for my patients. But today, quality health care that is enhanced and extended and even saved lives is under attack. Obamacare is destroying American health care, and we've already seen the devastating results. Millions of people have lost their personal health care coverage. Millions more have lost or will lose their employer-provided health insurance. And those who still have insurance are quickly realizing that they may not be able to afford it. Patients are losing their doctors. Washington is taxing away medical innovation. And physicians, my former colleagues, are considering fleeing the field of medicine. And folks in rural America are losing their access to care. As Obamacare collapses, Democrats have offered Americans with a false choice. Either stick with this disastrous law or let insurance companies run the show. But there's a third option. There's a better option, and that's patient-centered health care. As a physician, I know exactly what this would look like. It's a system where patients and families and doctors are making medical decisions, not Washington, D.C. That's why for 3 straight Congresses, I've introduced the Empowering Patients First Act. Our plan permanently repeals Obamacare and replaces it with patient-centered health reforms, like allowing Americans to purchase insurance across state lines to increase competition and to decrease costs, providing tax deductions and credits so that every single American has the financial wherewithal to purchase the kind of coverage that they want, not the kind that the government forces them to buy, and making insurance portable so that Americans can keep their coverage even if they change their job or they lose their job, ensuring those who have a pre-existing illness or an injury that they're not priced out of the healthcare market, and ending the costly practice of defensive medicine while still preserving patients' rights, and protecting our First Amendment rights, which is so important, by safeguarding religious liberty and conscientious objection. Now, you're probably wondering, how much is all that going to cost? After all, Obamacare has an overwhelming price tag of nearly $2 trillion in its first 10 years alone, and that's more debt that's being passed on to our children and our grandchildren. But our plan is different. Today, I'm so pleased to announce that according to an analysis by former Congressional Budget Office Director Doug Holtz-Eakin, the Empowering Patients First Act will save American taxpayers $2.34 trillion in its first decade alone. That's right. We can achieve the kind of health care that puts patients first while saving taxpayers trillions of dollars all at the same time. And we can do all of that without raising your taxes by a single cent. You can learn more about this study by visiting my website, tom.house.gov. Here you'll also find information about all of the patient-centered solutions contained within our positive solution, our alternative to Obamacare. I hope you'll join us in spreading the word about the Empowering Patients First Act, H.R. 2300, and our goal of restoring affordable, quality health care in America. Thanks so much for listening.